Hello and welcome to another lecture series on NCLEX. Today we are going to see the difference between hypo and hypermagnesemia and how that is going to symptomize in the ECG. Let us start off with hypomagnesemia. That means whenever the patient blood has got low levels of magnesium. So you will see their ECG will have prolonged PR interval and also their QT interval will be long. So yet another thing that you have to really remember in this is when that long QT is not intervened appropriately, that can lead to something called as torsade point, which is a lethal rhythm, and the patient can die because of that. So remember, in hypomagnesemia, you will see prolonged PR interval as well as prolonged QT interval. If not treated, it can lead to torsade point. Now let us see what happens to the ECG when the patient is in hypermagnesemia. There is high amount of magnesium in the blood. You will have wide flat P wave, prolonged PR interval, and there will be wide QRS and ST depression, and most importantly, there will be tall T wave. If you remember the previous lecture on hyperkalemia, you will see most of the symptoms with the hyperkalemia is similar to that of the hypermagnesemia, but there is one distinct feature here. So in hyperkalemia, you have seen tall peaked T wave, whereas in hypermagnesemia, what you're going to see is just a tall T wave. There is no peaking of T wave happening in hypermagnesemia. So differentiate between hypermagnesemia, hyperkalemia, and also differentiate that with hypomagnesemia. Hope that helps. See you in another video.